Hello again, this is Jim Henry. And this is the fifth part of 5 parts of Tinnitus 101, the basics for everyone. I don't know if you've watched all of these videos, but hopefully you have. This is just kind of a follow-up. If you are going to receive treatment or if you're in the middle of treatment, these are keys to receiving benefit from treatment. This shouldn't take more than about 10 minutes. So we'll go through them one by one. So treatment refers to management and care to ameliorate or slow progression of bothersome tinnitus. That's the definition of treatment. Some people refer to it as intervention, and they don't like the word treatment, or they refer to it as management. I prefer the word treatment. They all mean basically the same thing. It's what can be done to help a person to feel better about their tinnitus and live a more normal life. And management and care, this does not mean a one-way effort from clinician to patient. It is a collaborative effort between the clinician and patient. So the clinician is providing the information, the guidance, possibly some devices, but the patient or the person receiving the treatment needs to do the work. So if there's sound therapy, the sound therapy is something you need to do, learn what to do and do it on your own. If it's counseling and you're learning certain relaxation techniques or distraction techniques or exposure techniques or whatever you're learning, it requires your own effort to what we call self-manage your symptoms. And leading to habituation, which is the goal of treatment. So treatment is not just a one-way receiving treatment like taking a pill. Taking a pill is just a one-way effort. The doctor prescribes a pill, you take the pill, and you hopefully feel better. But other than taking the pill, you have nothing to do. With treatments for tinnitus are things you need to do in order to receive benefit. And basic education is essential before deciding whether to receive treatment. That's exactly what we're doing here. These 5 parts are the basic education that I'm talking about. And I would recommend learning this information before you sign up for any treatment method. It takes a couple of hours of your time, but I think it's well worth it, and it doesn't cost you anything to watch these videos and learn about tinnitus and hopefully formulate your questions, take them to an audiologist, send me an email, find somebody who can answer your questions, and make sure you're fully informed before you make any decision to receive any form of treatment. So we've already covered this. Treatment usually involves some combination of counseling and sound therapy. So we talked about TRT, TAT, PTM, all these different methods. Even cognitive behavioral therapy usually recommends some form of sound enrichment. It's not emphasized so much with CBT as it is with these other methods. And then these bimodal stimulation methods, they use some form of sound therapy. So sound therapy is commonly used to treat tinnitus along with some form of counseling. And then locus of control. Do you feel like you're in control of your own health? That would be internal locus of control. Or do you rely on doctors for your health? That would be external locus of control. Now, I mentioned that treatment should be a collaborative effort between the clinician and the patient, and that requires an internal locus of control. To self-manage your tinnitus, you have to do the work. You have to be motivated to do the work, and that's what internal locus of control refers to. So that's important, along with self-efficacy. Do you have self-confidence in the ability to perform the advised self-care actions? And I'll just read this. Success is generally achieved by first breaking skills into very small, manageable tasks. So sometimes it's just overwhelming. I just can't do everything, but I'll start small. It's just like if you want to clean out your garage, just start with one box at a time. don't look at the whole thing and get overwhelmed by the task ahead of you. Sometimes tinnitus treatment can feel that way. There's so much to learn, so much to do. That's been an issue with tinnitus retraining therapy. The counseling is very complex. It tends to get simplified by providers, but if it's conducted the way Dr. Jastroboff has designed it, it's very complex and can seem overwhelming. So you have to take it one little piece at a time. And if you have a sense of self-confidence that you can do that, that will carry you a long way toward effective self-management of your tinnitus. So this will conclude all 5 parts. This one quote I think is just so good that I couldn't leave it out, and I'm going to end with this. This is from Languth et al., 2023. Their article titled Tinnitus Guidelines and Their Evidence Base. The ultimate goal is to help the tinnitus patient. Clinicians should have the leeway to choose appropriate treatment, even if the quality of evidence is low, which is the case for most treatments. A holistic approach that considers all factors should be used in making clinical decisions. So what that tells me is that they're saying there are many different ways of treating tinnitus, many different ways of managing tinnitus, and no one way is proven any better than any other method. And so by becoming informed, you become aware of all the different options and possibilities, and it's a matter of choosing what you think is best for you. Do you like your provider? Do you trust your provider? Do you understand what the method is? Do you know how much it's going to cost? Are you able to put in the effort that's required? There's a lot of things involved in signing up for any treatment method, and it's a combination of the research that's been done. It's a combination of that along with the provider and the provider's expertise and the person's values and interests and desires and opinions. So it's those 3 things. It's like a 3-legged stool. If you're making a decision for treatment, consider what research has been done, consider the expertise of the provider, and consider what you think is best to help yourself. So I'm going to end there. We're done. We've gone through all 5 sessions. Hopefully this has been helpful for you. I would like to make myself available to anyone who needs help, and I'll generally answer emails. I'm available by text. I'm on the Pacific time zone, which is the west coast of the United States. And I also do a LinkedIn post every day, 5 days a week, something informative about tinnitus. And then we also have tinnitus support groups. We have a hyperacusis support group. These are all online. You can sign up for these, and there's a lot of different support groups around the country, and you can check them out and see if those will be helpful for you. There's a lot of options available for getting help, and hopefully these 5 sessions have been helpful for you, and I look forward to hearing from you if I can be of any assistance to you. So thank you for being a part of this effort. And best wishes for success in whatever you need for your tinnitus.